This is Dr. Randy Cale at Capital District Neurofeedback. One of the most common questions I receive is the following. How long does it take for neurofeedback to work? Well, first of all, it's a great question and a very reasonable question, yet a very difficult one to answer. The reason for that is that brain states, or the condition of the brain, varies considerably from person to person. Some folks are seeking help and they're having struggles focusing, or they're having troubles attending. Perhaps it's ADHD types of symptoms, but their overall brain state is pretty good. Other folks have much more severe issues going on with their brain. Let's imagine, for example, the different conditions of human bodies. If we were to walk out on the sidewalk and perhaps it were normal times, we would see folks walking by. We'd see some folks who look like they've been to the gym regularly. We'll see folks who are a little bit out of shape, and we see other folks who haven't been to the gym in 10 years. They're huffing and puffing going up the hill. Well, the brain is similar. When we do a map of the brain called a QEEG, or quantitative EEG, we're able to assess very accurately the overall brain state. That gives us an idea of how severe things are in the brain, and that then tends to translate to how long it's going to take for neurofeedback to achieve the ultimate result. Now, having said that, most people who are training with neurofeedback begin to feel differently within 2 to 3 weeks. They begin to notice shifts. They're sleeping a little better, their anxiety is down a bit, they're not as reactive, they're able to focus a little better, but it's not where they want to be. To achieve the ultimate outcome that most people want, the length of time varies from 2 to 3 months to anywhere up to a year. If you've been in an accident, have a severe trauma, if you've been on medications for years, if there's ADD and it's severe and medication's not managing it well, these are the kinds of things that require longer-term treatment. So the bottom line is this. Treatment varies greatly in terms of duration based upon how severe the condition is. And that may not necessarily be reflected by symptoms, although it usually is. So the more symptoms that show up, typically the more severe the brain state. And so at a minimum, you could think of it as a 2 to 3 month training process. A lot of people are done with training and achieve success in that amount of time. Other folks, it's more like 6 months, and if it's a severe situation, it can be up to a year. If you have more questions, feel free to reach out and set up a free consult with me. I offer these consultations to provide answers to people when they have more complicated issues or specific questions. I'm happy to do that at no charge. And if you have those questions, you can speak with my assistant at 518-383-0600 or email her at drcale.assistant@gmail.com.